Welcome into the Red Pill. This is episode 4. I'm DJ Skee. Today's topic is caring for the poor and vulnerable. I'm joined by Gilbertson and Rosie Perez. Thank you so much for joining us today.
Thank you for having us.
Thanks for having us.
So first up, let's get to a basic question a lot of people might know, but in your guys' perspective, why is this such an important issue? Why should people care about this? And they have a lot of their own issues to worry about. They have their own struggles. Why is this important?
I think this is an important topic because this is about bringing wholeness to our communities. It's about bringing wholeness to people, bringing them back into community, having them be active participant members. I always feel like, when everyone comes together, everyone does well and all boats float. And so we have a particular calling to reach out to those who are poor and vulnerable, and that's our mission. And we think that everyone ends up doing better and having a better common good for everyone.
Yeah, and taking it a step further, so we're doing this in conjunction with our friends at Providence St. Joseph. And how did they come together for this? And what is their shared vision and mission with this campaign?
Yeah, so Providence Health and Services and St. Joseph Health are two systems that both started by a group of women religious a long time ago and serving their communities. The systems were adjacent to each other, had been working and partnering for many years, and as part of the dialogue of looking at how we can continue to serve the communities, what surfaced was, well, why don't we just come together and do this together? And the reality is that the problems we're trying to solve in society right now are so large, you have to kind of tackle them at the scale that they exist. And that causes us to think about how do you bring systems together to work together going forward. And that really was the genesis of thinking through, let's create Providence St. Joseph Health. Let's get these hospitals and clinics and physicians and community programs brought together. Let's understand what the best things are that are being done anywhere across the system and scale them rapidly. And we talked often through that. 1 + 1 has to equal more than 2. And it's been fun over the last couple of years making that a reality.
Yeah, it's so true. I mean, people don't realize that even if it's not yourself, it's the community which enables your life and everything else and makes the community that you live in better. And it's just so important. And for you guys, how does it drive your personal and the work that you do? Has to be such a good thing for you guys working on something so positive and that can really change our world, right? What got you guys personally involved in this?
I'm a nurse by training and background, so I have always been drawn to wanting to help others. But to be able to do it in this way, not necessarily at the bedside, to be able to be out in the community, addressing the needs, hearing from people to, figure out what their challenges are, what are their day-to-day, and to be able to be part of an organization that wants to be responsive to that wants to be part of the solution, that wants to be at the table and talking with others to try to come up with that solution. Healthcare, anybody can have a hospital, anybody, but I think this is different to be wanting to work with others and create solutions that make life better for others.
Absolutely.
Yeah, and for me, I started in public health and actually was in government and spent my first few significant years in healthcare running a state health and social service agency for one of the states that we operate in. And it was in those experiences of dealing with vulnerable populations, and the stories I could tell from working with families that had children in the child protection system and healthcare needs that were not being addressed, and the behavioral health burden, mental health and substance abuse challenges. For me, as I was thinking about transitioning out of government, I wanted to be in an organization that was going to tackle those problems at the community level. And it was just wonderful to be able to join an organization that says, our work extends beyond the 4 walls of the hospital. And it's been 13 years later, still doing it, enjoying it.
It's incredible. Good for you guys. Now, from your guys' perspective, being experts in this field, there's so many different issues, so this is kind of a loaded question, but what is the single biggest thing we should be focused on right now, or the biggest issue that we're facing right now in dealing with the poor and vulnerable? And what can listeners out there that want to contribute and do something, what should we be focused on and worrying on, and what can we actually do to help out?
Yeah, I think the 3 big issues that are facing us right now that are very interwoven are access to care, housing, and mental health concerns. And how each of us can contribute to that probably varies where you sit. I think all of us can contribute to how do you make sure of a policy environment. We get government to actually do what it needs to do to make sure people can be insured, that they can be covered, and that they can access an affordable healthcare system. What are we doing to contribute to making sure housing is affordable and that there are options for folks that are having housing insecurity issues? And I think you can volunteer, you can look at ways in which you can be a local activist, and the ways in which you can partner on projects. And then I think lastly, mental health. And I think everyone has a role to play around destigmatizing mental health care, mental health issues. And I think if people lean in, both at the personal level and at the collective level, we can tackle these problems.
That's true. And we had one of our other Red Pill episodes focused around mental health and how important it is, and trying to break down a lot of these stigmas that do exist out there, and getting people comfortable in talking about it. And it seems like one of the things that we really focused on in our discussion was the fact that a lot of care that we do now isn't preventative. It's always reacting to the fact with things. This has to be probably even a bigger problem in poor and vulnerable communities because they don't have money to go in or even think about preventative care. Everything is kind of reactionary. Is that one of the key issues that that you guys see out there?
Yeah, I think it's easy to think about when you think about healthcare problems to say, let's try and solve it with more healthcare services. And the reality is that the two leading indicators of health status in a community are economic opportunity and the access to housing, affordable housing. Yeah. And if people are housed and they have a job, you have a better chance of being able to navigate through this world that we're in right now. You're going to have genetic issues, and you're going to have family health issues and other things that happen. But you've got to focus on those issues up front.
And this is where people can get involved to be able to be advocates, because those are services that are not covered by a lot of health plans. And as you said, people have to come up with that money out of pocket. So to the degree that they can educate themselves and get active and advocate and show up and push for policy changes that will be able to provide that preventive care, the better everyone will be.
That's great. And it kind of leads to my next question. How does the work that you guys do relate to the current healthcare debate?
Right. Well, I think as an organization, we've been focused significantly about the healthcare debate in the two areas of protecting the Affordable Care Act, which really was about making sure people had access to health insurance. And then I think to be fair, and as a critic of the Affordable Care Act, what it really didn't tackle was the cost of healthcare. And we're bankrupting people because of the high cost of healthcare. We're making people avoid or delay care because of the high cost of healthcare. And there are things we can do in changing, I don't want to get too wonky, but change the way that healthcare is paid that incentivizes the right things: preventive care, holistic care, team-based care. And I think our work really is about how do you create a policy environment to make that operationally happen, and then internally, how do you get your costs down? Right? How do you make sure there are more access points for people at the local level? And I think our work is both creating the future state that we need, but also acknowledging that you've got to bring partners along and you've got to do it with government.
Yeah.
And at the same time, sharing stories. I mean, we talk about Medicaid. There's so much talk about doing away with Medicaid, but the reality is that that's a insurance for the majority of the people that cannot afford anything else. Those are the poor and vulnerable. And the reality is that we felt like we needed to educate, because people just kind of thought, Medicaid out here, they don't know really what it is and what it's covered. It's referred to as an entitlement. But the benefits, it's preventive care, it's access to care, it's for children, it's for the elderly, it's for the disabled. It is those that are at the margins of our society that we need to look after. And so that's why we did the Faces of Medicaid, because it's people from all walks of life. Maybe someone needed it just for a short period of time, others needed it for a longer period of time, but without that, they'd be in a worse off situation.
This is a basic human right. Everybody should have equal access to medical care no matter what. And that's kind of our job as a society to do that. And with you guys at Providence St. Joseph, what other types of services do you guys provide to care for the poor and vulnerable? I know there's a lot that you guys do, right?
We have a range of services. I'm thinking of a tattoo removal program. So again, we talked about bringing people back into community. And sometimes, people have made decisions, and now that they're, further along their, path in life, that, that's holding them back from being successful. It's holding them back from getting a job. So we'd be able to provide programs that removes tattoos to be able to allow someone to live a fuller life. Respite care for the homeless. Homeless come into our facilities seeking health care and continue to need care, but we can't discharge them in the street, can't provide those services in the shelter. So we provide a safe space for them to recuperate a little bit longer than if they need. Food programs. We have a lot of programs where we provide emergency nutrition for families. We have clinics, we have, low income, free clinics that, if people are in need, to be able to access, basic health care.
You think about the housing, whether it's respite housing or other housing opportunities. I think sometimes we think about these as doing good activities just to feel good, or that we're doing really mission-driven work, and it is mission-driven. But then I also think about the cost of a person who cannot be discharged out of a hospital because there's no safe place for them to go. And we're going to keep them at a hospital where it's going to cost $2,000 or $3,000 a day for them to be in a hospital. Or you can discharge them because they have a substance abuse mental health disorder and they end up in a jail where it's going to cost society $150 a day to house them. Or you can work with a nonprofit partner that can get them into safe housing for $15 to $20 a day. So as a society, there's a great opportunity here to think about this both as mission work, serving people in need, but also just being realistic about we have scarce resources.
Yeah, it's very true. Well, I want to talk a lot more about the housing and homeless crisis going on right now in a second. This is The Red Pill, Episode 4. We'll be right back with much more in a second. We are back. It is The Red Pill, Episode 4. I'm DJ Skee, joined by Joel Gilbertson and Rosie Perez, where we are talking about caring for the poor and vulnerable. And one key issue that seems to keep coming up in this conversation and other ones that we've had in this Red Pill series, and it's more relevant to ever than I think us, specifically in California and Los Angeles, and even some of the areas that Providence St. Joseph is very big in. You're talking about Seattle, San Francisco, of course, is kind of one of the same in essence, the housing and homelessness crisis. Let's talk about just like the crisis going on. So for people that don't know, I mean, how tough is it to live in one of these major cities now and survive? I mean, you're looking at a city like San Francisco, which, if you want a box, you're spending thousands of dollars a month, and people are literally being forced out of their homes and out of their communities and having to drive or, figure a way to move outside of the city and get in there. How big of an issue is this really in terms of everything that we're talking about with caring for the poor and vulnerable?
Oh, it's a tremendous issue, and I don't think there's an urban, and even moving more into suburban areas too, but an urban area that's not dealing with just a tremendous challenge of how do you have affordable housing, how do you keep people in housing who are at the brink of becoming homeless, and then what do you do with a tremendous homeless population? And one of the challenges with that is housing is expensive to backfill. You want to help people get off the streets and get out of homelessness. Well, they've got to go into a home, and in these urban areas, it's incredibly expensive to build these housing projects. I think there's a reality too that we deal with, which is if you are not housed, you are much more likely to be deferring other things that keep you healthy, and more likely to end up consuming resources downstream. There's not going to be easy options, and I think the reality is you have to also look at the fact that within the homeless population there are different groups within there, and there's veterans populations, there are folks dealing with substance abuse and mental health issues, there's individuals who are employed but simply can't afford the cost of housing. And you've got to be really thoughtful about how do you serve each of those populations. Yeah,
it's not just everybody doesn't just fit in a box. There's lots of different unique scenarios. How many people would you say, in terms of the homeless, by percentage and rough percentages, what percentage is this of people that are in these situations simply just because they can't afford it, not due to substance abuse or different other issues?
I'm not sure I know the answer to that question. I hope someone smarter than me does. I think both cohorts are large.
Too large.
And you look at the research that can show linear correlation between as the cost of housing goes up, how the percent that it increases the amount of folks that become homeless. I think the reality is over the last couple of years, it's becoming more and more being driven by the cost of housing. The chronic mentally ill, the folks that are dealing with other issues that are causing them to lose housing. Those problems have been there. And in many cases have been exacerbated by other stressors. Just to be honest, just being homeless is a tremendous stressor on the body, on your mental well-being. But I'm not aware of a single urban market on the West Coast right now that's seeing this number going in the right direction right now.
Right. And I was going to just share a story. In December, I actually had the opportunity to drive from Vancouver all the way down to Napa. And I think it didn't matter where we stopped. We just saw encampments of homeless. And I would say maybe some mental health, maybe some substance abuse, but that wasn't the perception that I got. It was just people that were just on the brink of homelessness, and either they lost a job or their rate of pay wasn't keeping up with, what they needed to spend for housing, would stay in their car and then ultimately had to give that up. I mean, decent people wanting, to be in a safe place and to know that they're just being housed in outdoor tents is just not an answer. And when we talk about the dignity of a person, But it didn't matter if I was in Seattle, if I was in Napa, or I'm here in LA, just, large encampments and just see it everywhere.
And what role, and I guess what can we do about these? Because if you look at, one city that stands out so clearly is San Francisco.
Right.
You see just the astronomical costs and the tech scene that's kind of taken over, and a top percentage making such a large amount of money, and you go out and you're seeing, millions, tens of millions of dollars for these condos and apartments and things, and then you literally walk down to the street and there's people that can't, even afford a bottle of water or anything. And you look at that and you're like, how does this happen? How can this happen? And where is that middle ground too? What can we do? How do we get more affordable housing in there? Is this a policy issue? Is this something that we as a community need to get in there? Because even if you start making, if you're looking in San Francisco, you're making 30, 40 grand a year, which are starting entry, decent salaries for a lot of that, you can't live. You can't find a place to live. So how do we get through that so it's not the rich just getting richer and the poor staying on the bottom? What are real solutions that we can have for this crisis?
Yeah, it's going to take a little bit of everything. It's undoubtedly you're going to have to invest more in making sure that you have affordable housing and you have an inventory of affordable housing that to support the lower wage workers and also those individuals who are financially on the brink. And that is only going to be manifested through deep public-private partnerships.
Yeah.
The government's going to have to figure out a way to put resources in and spend it more effectively.
Yeah.
And I think that's a fair criticism. Are we getting value? Are we getting return for all the dollars that are being invested in and being held accountable to that? But you're going to have the private sector step up too. And I think it's those partnerships, those public-private partnerships where you've seen society tackle big problems in the past, and those have to continue. I think about one of our communities that's actually done a very good job at trying to tackle the chronic homelessness issue. And I think about Spokane, Washington, which is one of the communities that Providence St. Joseph Health serves. And there's been a long-standing, multi-decade partnership between through the private sector and the public sector to say, how do we tackle homelessness at scale? And there you have nonprofits partnering with the healthcare system, partnering with government. Government makes sure that the land's available. The nonprofit there, in that case, it's Catholic Charities there in Spokane, works through a tax credit program to get the housing inventory online. Providence donates the funds to make sure you can build the building and has the physicians and the nurses that go over to care for individuals that go in, because the people who are initially housed, they come in with a load of healthcare problems.
Yeah,
they've been homeless, and if you don't tackle the behavioral health issues, the underlying healthcare issues, they can find themselves back. In some cases because of behaviors, in some cases because of health status, back on the streets. And that partnership has scaled, and it's on an almost annual basis. They're opening up another building, and you've seen the homeless problem there not grow and not see some of the tremendous loss that's occurring right now in other communities.
And as a community, we just need to step up and recognize, and I think that's where the everyday person can show up, become educated, and advocate for these developments to happen. I mean, I'm just listening to all the amount of time and resources and planning that it takes to bring everyone to the table to make this a reality, and then I just paid $1 million, $2 for my house, and to think that there's going to be a development for the poor and the vulnerable, the homeless, they'll start to not want that and to advocate against it. So we need the others to show up to say they're part of our community, they're our brother and sister, they're human beings, and we would benefit by having them in the community.
And another place, of course, that has a huge homelessness population is literally right where we're standing. We're in the middle of Hollywood, California, and the crazy thing is we're in this beautiful studio outside of, the fanciest restaurants and clubs in the world. You see every celebrity every night coming to this club, yet you walk a block down and you see people who have been on the streets for years or decades, and a lot of them obviously need help. And even just driving along the highway, the 101 right over here, you'll just see these encampments. Like, there are many cities in essence for that. How do we even begin to clean this up? Because it seems like such a massive problem. And then that's without even considering taking a drive down Skid Row, which I encourage anyone that's in LA to do. Just if you've never done it, you'll see how widespread this is. This isn't like a few people, 10, 20, a couple hundred. This is tens of thousands, hundreds of thousands probably in Los Angeles alone that are dealing with that. And sometimes these problems seem so big. Like in my eyes, I'm like, where do you even start? It's too big. And there is, like you said, there is that delicate issue on both sides. You don't, if you just spent $1 million on a house, you don't necessarily want, a low income property coming next to you because it's going to hurt your property value and that money that you've worked for. So not saying that it's right, but there's a lot of other considerations. So what can we realistically do as kind of next steps? Is this just us all getting together and addressing this issue head on? In your eyes, what would be the most beneficial things, and especially things that our listeners out there can do today to help these causes that, I think we all kind of agree in the same lines for? How do we get aligned and on the track to actually do something instead of just being talk?
Yeah, that's the billion-dollar question,
right?
I mean, it really is, and I think the most important thing you can do today is care, right?
Yeah.
And just actually care about this issue.
It's true.
And be willing to look at how you can serve locally, how you can contribute locally to solve this problem. This problem is so large. I personally don't believe we're going to really turn the corner until it is government fully leaning in on this and tackling it at the crisis level that it is. And that does mean putting more resources into it and having more accountable projects that go in. The private sector is going to have to lean in. The business community is going to have to lean in on this. It's to everyone's benefit for us to make sure that people are living in dignity.
Plus, it gives us more workers on the street to help build cool things. And people always get scared of there's more competition. But in essence, as humans have populated over time, there's significantly more on the earth than there's ever been. Yet we're creating rockets that go to Mars. The more humans we have, the more problems we can solve. So it's better to have more people in the workforce. It's not competition necessarily.
Yeah, I think there's also an understanding, and it's where we've worked in some communities of local partnerships between nonprofits and the health system and local government, where you sometimes get this thinking that sometimes surfaces where folks say, well, if we really develop these services or have these housing options, it's just going to bring more homeless people to our community. And that's not the case at all. Yeah. And when we've looked at, and we've worked with partners to look at the data, the people that are in those facilities or in those services were there and have been there for a long time, and people are not coming just to get the services. Yeah. But what also underscores is that to really tackle this well, you also get another byproduct, which is quality of life goes up, both for the people who are being housed and also for the community generally.
Yeah.
I think so. In fact, this is one thing that people can do, and is to be able to talk to people who are homeless,
right.
And not be afraid of them and engage them. I mean, I've done it a number of times here in the LA, not putting myself in danger, but, just talking to someone and just, tell me your story.
Right.
Yeah. And the stories are incredible, educated, working members, and some of them still have jobs, but they just don't have a house. So they're having to coordinate all these activities of finding a place to wash their clothes, finding a place to take a shower, and then still show up to work the next day, and then trying to figure out where they're going to stay, and that they have to be at a shelter, in hopes that they can secure a bed. But to hear their story and to know that they've got an education and they worked and they were engineers or they were teachers or they were, and I'm just like, how does this happen? How does this happen?
It's a great question. How did this happen? I mean, you go down, again, especially Skid Row, wait, nobody did anything and noticed it getting worse and worse? I mean, what allowed this to happen and get to this epidemic level that it's at right now without somebody jumping in and saying, hey, let's fix this?
I think this is a perfect example of where if you can turn a blind eye, you will. And I think folks have done that over time. And it's a confluence of a lot of forces that are different, and you have to tackle each one of them. Some of this is the housing cost. That's a part of the problem here. Some of it also is the fact that we have not taken care of mental health concerns as if they are the equivalent of any other health issue in the body. Our health insurance for the longest time treated mental health issues differently and substance abuse issues differently. For the longest time, if you were a male between 22 and 64, public health insurance programs weren't available to you. Medicaid was about the poor, pregnant women, babies, and seniors. So we had a whole cohort of individuals and a whole cohort of individuals who were insured who did not have access to mental health services. And the reality is, if you're not insured for it, and you're not going to pay for it, no one's going to provide it. And so the policy environment was just a toxic soup of escalating housing costs, lack of delivery and services for mental health concerns. And once it starts to snowball, it takes more to stop the problem and to fix it. And I think it's to some extent, folks have walked away from the problem.
It's very true. This is the Red Pill, episode 4, Caring for the Poor and Vulnerable. We'll be right back in a second. We are back. It is the Red Pill, episode 4. I'm DJ Skee. We are talking about caring for the poor and vulnerable with Joel Gilbertson and Rosie Perez. So for those just tuning in, let's talk about and recap kind of who are the poor and vulnerable exactly? What are we talking about exactly?
You know, when we talk about the poor and vulnerable, and certainly within our organization, it actually has a lot of meaning and a lot of definitions. We talk about those that are at the margin of society, those that are defenseless, those that are voiceless, those that are just suffering. And then we have different layers of it. I mean, sometimes we talk about, economically poor. We talk about financially poverty that prevents people from, bringing their best self to our communities and to our society. We also talk about being poor in spirit, and so we bring in the mental health piece to that. And we also talk about being poor in health. Just because of lack of preventive care or lack of access to care. So we have a broad definition of the poor and vulnerable, but with that, it's also kind of addressing those systems that keep people back, that hold them back and don't allow for an equity or an equal chance of being their best and contributing to society.
I think there's also a reminder in there that when you work in and you walk through a hospital, I think sometimes it's easy to forget that for all of the folks who are there, not because they work there, but because they need to be there, that is probably one of the most memorable days in their lives when they're in that facility that day. A new grandbaby is being born, or a mom is going into surgery, and I think it also is a call to us to remember that people are very vulnerable when they show up in our facilities. About ready to go under surgery or to go through a very momentous change in their life. And I think it's a constant reminder that we're touching people at very sacred moments of their life.
Jumping into it again, how does improving the quality of life for the poor and vulnerable improve quality of life for us and everybody as a community?
I think there's a lot of sayings that said, we're measured, our morality is measured by how we treat those who are poor and vulnerable, the most vulnerable of our community. I think they have a richness that they bring that makes our community whole. When I talk to people and I think about their creativity, their, ingenious thinking, their knowledge, their skill set, that's what makes a community, come alive and to prosper. And to know that we have people that can't participate in that, that's just kind of really disappointing to me. And I don't want to be in that community where we ignore people, where we ignore who they are as a human being. I mean, we believe as an organization that everyone has an inherent dignity. And not to acknowledge that and not to bring them in and have them sit at this table with us and come up with the solutions, I think would be devastating for us. I think we are the ones that end up losing out because everyone has a special gift or talent. And if we have these systems that are set up that don't allow for them to be able to share that, then I think we're not doing our best.
That kind of leads to my next question too. What are some of these institutional systems? Is there anything out there that, obviously favor certain demographics over others? And more importantly, I guess, is there institutional discrimination towards poor and vulnerable in different scenarios?
I would say that there's, I can recount many stories of where people think that they're being helpful by offering programs, and I will give some examples. Programs for the disabled to be able to access, healthcare and housing, but you've got to physically go to an office and make your way to the second or third floor, and there's no elevator. And there's nothing but stairs. I mean, you've got to look at yourself as an institution to be able to say, what is it that you're doing? Thankfully, we're doing a lot better, but I remember the days where if someone needed to access free health care, if they needed to get food assistance or they needed to get services, they had to go and show up at different places and fill out a different set of forms. We've moved away from that, but it's just like, can we step back and think, how can we make processes a little bit easier? How can we challenge organizations and industry just to be able to ease, we have a saying in our organization, ease the way for people to make it easy for them to access the services that they need and to show their talents and to bring their gifts to the table.
It's one of the reasons I'm so excited about technology because I often think about the example of the mom with 3 kids who's an hourly worker, and for her to bundle them all up and take time off from her job and go into a clinic, something that maybe my wife doing that doesn't have to worry about the fact that we're going to be able to pay the mortgage at the end of the month. She's not getting paid because she's an hourly worker, and she has to lug them into the office, see the doctor, hopefully get everything taken care of in one visit.
Take 2 or 3 buses.
And get home, and just the burden that it places on them. And I think one of the exciting things over the coming years is how technology can be a way for that mom who has a smartphone to see their clinician and to get their care needs met where they are. So I think about how do we get the built environment of healthcare aligned so that for the poor, for the vulnerable, it's easier for them to get what they need and helps them get on with what they have to be focusing on that day.
But another example, the idea you just said, that they have a smartphone. There are some people in our community that feel like, oh, they can afford a smartphone, so they don't need help. Phones are so cheap these days.
Go find one on the street.
Exactly. So they're, accessible and, readily available and inexpensive to the point that that's where we need to be driving information.
And that kind of gets to my next question. So to what extent do public and political discourses and things like this shape the public's attitude to people living in poverty, and to what extent is it the other way around?
Oh, I think the rhetoric that's going on right now around public programs and around the role of government in solving these social problems is it's just not helpful. And we've polarized and politicized something that is as basic as allowing a person who has a health condition that threatens their life to feel like they're not worthy of getting services, or they're not worthy of being insured for some reason, or they're living off the government dole. And earlier you mentioned the healthcare is a basic human right.
Yeah.
That's something that's been deeply embedded in our organization from its founding. And that's something we have to continue to advocate for. But to do that, you got to tell the stories of who are the people who are on Medicaid. No, it's not this person who's sitting on their couch playing their Xbox and just doesn't want to get a job and wants someone else to pay for their health care. These are people who are struggling in low-wage jobs where their employer either can or can't, but doesn't offer health insurance. These are seniors that are in our nursing homes. These are kids who are being born right now who have simply just don't have a family that can afford their health insurance.
Yeah.
And that's why we focused a lot on how do you tell the story of the people who are on Medicaid.
And one interesting thing for that, and I know you guys at Providence St. Joseph's did something with this around Dizzy Wright.
Right.
So Dizzy's an incredible rapper and artist that we play all the time on Dash Radio, and when you guys talked with him, he was very adamant that he'd be blind if it wasn't for Medicaid coverage and organizations like you guys that take care of people in need. So he also spoke about how he and his family were homeless for a while in his childhood, and without assistance, they wouldn't have made it out. So is this kind of common in a lot of communities and how you handle it? And I also wanted to say that too, to showcase that this isn't just people like, oh, who is that homeless guy on the street? These are people that you're listening to and know and talking about how important these programs are.
Yeah, telling the story of folks that are on Medicaid is an important thing. So we launched the Many Faces of Medicaid effort so that folks could see and connect with and understand who are the real people that are using Medicaid. And to your comment, the reality is the people who are getting Medicaid services right now, it is costing a whole lot less to society because someone got served and was able to get their health condition addressed at a younger age and now aren't going through decades of challenges because of that. The stories individually are just so compelling, and it's been exciting to be able to bring some light to those.
And I think, again, if people just talk to one another and acknowledge that, you would hear a lot more of those stories to know. I mean, and certainly as a kid, you don't know that you're, air quotes, poor. You don't know that you're, what is Medicaid? You don't know that. But at least your family and your parents know that if you need to get, to a doctor, if you need to get healthcare services, that's what it's for. It's for those instances where you need it the most.
It's very true. I think it's a great time to take a break and play some Dizzy Wright right now, since we were just talking about him. It's the Red Pill right here. It's Dash Radio. I'm DJ Skee. We'll be right back with our final segment in a second. Welcome back to the Red Pill. This is episode 4. I'm DJ Skee. We are talking about caring for the poor and vulnerable with Joel Gilbertson and Rosie Perez. We are here courtesy of Providence St. Joseph, who put about, $1.4 billion back into the community every year?
1.6 billion.
1.6. Sorry, I'm off by $200
not that we
million.
count. Not that we count.
That's insane.
Yeah, it's an inspiring number.
And this is annually.
This is annually.
Not like over the course of 100 years.
No, this is annually, and this is we're given a lot of blessings from society, right? We're allowed to care for people. It's been very important to both be intentional about it and to be able to touch lives by returning value back into our communities. And we do that through something called community benefit. But what it is a collection of programs and services and offerings that make sure that we're taking care of our community, particularly before they come into our hospital, because that would be great if we could care for people's needs in a lower cost way too, and help them live the quality of life they want to lead. But that 1.6 billion has areas within it, and 1 billion of that is actually our costs for caring for the Medicaid population, where Medicaid itself doesn't pay for those services. Medicaid does not, it's an important program, but it simply does not reimburse for the actual cost of delivering care. So we have to find ways to make sure you can still provide those services. And one of the things we do is make sure we try to get some of these other investments into areas where it helps people get their needs met at a lower cost. So a lot of that community benefit goes into free and discounted clinics at the community level. A lot of it also goes into, we talked about housing. How do we put money into supporting partners to get housing needs met, or look at ways in which we can address behavioral health challenges, whether it's substance abuse or mental health programs. All of these, we believe, both benefit the community, but also collectively help make sure that these services can continue into the future.
I even think about subsidizing some healthcare providers to be able to go into those areas that have no infrastructure, and to be able to allow them to come in and provide the care without having to worry about anything else. And so, I'm glad that we're able to do that. And then for the rest of the millions, I like the fact that it's not something that the health system says, oh, you have to, pay for this, or you've got to do this. We invite the members of the community to come in and sit down, and we actually go through this process where we prioritize the needs. And sometimes we might think, oh, clinics, and then the community says, no, we've got issues of violence. We've got issues of, we have other concerns that need to be addressed first, and then those get prioritized. And so we work very much hand in hand with the community members and community organizations and businesses to be able to say, where should those dollars go and how would they be best used, and have the best outcomes.
And one thing that we've talked about in past Red Pills, and it kind of gets lost when we're talking about healthcare and things that money is spent on, is so many people are focused on the physical healthcare and going in when they're sick, but mental health is a big area of focus for you guys, correct?
A tremendous effort. We were blessed as bringing together Providence St. Joseph Health to launch an organization to focus on how do we change that national conversation around mental health, how do we address stigma at the community and national level, and how do we build partnerships that can tackle this problem. So that was Wellbeing Trust, an entity that we have launched and look to partner with others around. But we're also saying, okay, we're a big healthcare system. We employ 118,000 people. What are we doing to make sure that every one of the folks that work with us and at our organization are being cared for, them and their dependents, with good services for addressing their mental health and well-being? What are we doing in our clinic settings to make sure that we're reaching out and making sure care is accessible? One of the challenges we face, though, going forward, which is always going to be front and center for the foreseeable future, is just the number of clinicians and folks that are going into mental health services is simply not enough. And so we've got to find ways to get more psychiatrists and psychologists and mental health clinicians into the organization so they can serve the communities. That's a national shortfall. And then also finding ways where people can get their mental health and well-being needs met in different ways, because there is a real talent problem right now.
And I think, again, we look for those opportunities to partner with the community, to go into schools. I think I'm most proud of the school, the programs that we have that are done in collaboration with the school districts to be able to talk about, the stigma of mental health, rates of suicide. Some of our communities have high rates of suicide, so we work in partnership to be able to address those. substance abuse. I mean, just to be able to do this range. And even as a caregiver, I mean, as a nurse, I was just kind of thinking of these, mental health diagnoses, these big, heavy diagnoses, and then to realize it's something like anxiety, to realize it's, about depression, that it's just this range and scale of mental health trauma that we have not put in enough, education and resources to talk about the trauma that people have experienced, the violence in the community, violence in their home, an adverse, situation that has been experienced. People bring that in their lives, and unless there's someone to talk to about it or to get it addressed, it plays out in other aspects of their life.
I think there's a tendency to think that mental health issues are more prevalent in the poor and the vulnerable. And the reality is you can go to any large corporation, anyone, even our own, and say, for your health plan, what are the top 2 drugs that you pay for your employees? And in any organization you go to, it's going to be anti-anxiety and anti-depression drugs. This is a challenge that impacts all socioeconomic classes, geographies, races. It's something that we all share, and the only way you get out of the gates on this is when everyone's comfortable to share their story, and also be comfortable to listen to someone else's story, because it's something that's been sitting there for some time, and we've got to talk about it candidly.
Yeah, and one thing I was going to ask too is, what is the most, the biggest issue you guys think facing the community? But just in hearing your answer too, Rosie, is that, I think there isn't a broad stroke answer for that. And I think it's even localized to each individual community. As you mentioned, certain communities have higher rates of suicide and things like that. And you can really look by zip code and see what issues are facing that. And of course, there's, major issues that face everyone. But, I was going to end with my question of what can people out there doing? But I think it's just looking and getting involved in your local community, because there's not just one broad stroke answer, especially when there's so many issues. I mean, we haven't even touched on the access to healthy food and things in different communities, and that's something that plagues more inner city communities that don't have those things versus other issues with suicides and various other things. So what advice would you give to listeners and how they can get involved? How do they get started? Is there somewhere that they can look or go to if they want to reach out and play their role in assisting their community and assisting the poor and vulnerable?
Certainly, I mean, our organizations were always involved. We've got all kinds of activities and meetings and events that are always happening, within our, institutions and our clinics. And then obviously we work very closely with the schools. So the schools are always, have some kind of learning opportunity or speakers or events, where it is an opportunity to be able to learn. So it's just to get involved and we have a lot of information that we share on social media. And so we're always promoting different events. So, I would even, drive people to our websites to be able to see, what's happening and how to get involved. But, it's about having a level of awareness and looking around and a lot of people talk about the impact of social media, and maybe that's kind of created some distance between people. But if we could just put that down maybe for half a second and look at someone in the eye and say, how's your day and what can I do to help? I think that goes a long way.
Yeah, I think if you can do 3 things, one is know your neighbor,
Yes.
right? I mean, do you know your neighbor? Find that local nonprofit, whether it's your church or the food bank, that you can maybe volunteer in your local community. And then I would also say know your member of Congress and weigh in and share what your concerns are. You don't have to be a technical expert. Just weigh in and hopefully we can build a better world together.
It's a great way to end it right there. It's the Red Pill episode 4. I'm DJ Skee. We've talked today about caring for the poor and vulnerable. We'll be back next time with another important issue brought to you by Providence St. Joseph. Joel, Rosie, thank you so much for taking the time out and sitting with us to talk about these important issues in our community. And thank you guys for listening and taking the effort. We'll be back next time. Till then, enjoy the Red Pill.